there! Today we're going to talk a little bit about our postpartum care with Hearth and Home Midwifery and what that looks like in our practice. The first thing that we're really proud of about our postpartum care is that we offer a minimum of 4 one-hour appointments in the home after everybody has their baby. And we feel really passionate about that piece because we know that one of the main contributors to poor outcomes in the United States has to do with the postpartum period, particularly with maternal mortality and actually newborn mortality. So we feel that checking in and going to people's homes where they're living and caring for their baby and trying to recuperate from the experience that is birth allows us to kind of meet people where they are and see what's really going on, you know. How is breastfeeding going if they're choosing to breastfeed? How are they healing after their birth? How's their mood and what's their emotional experience? The postpartum period is so tender and traditionally has been a period that would be attended to by family and you know, that there would be a lot of support available. And what we see in our culture is that that's not the case, and a lot of people are really isolated and need a lot more support after they have their baby than they're getting. So we feel like we're able to make interventions by offering that in-home support 4 times in the first 2 weeks at a minimum.
When we come to your home, we do, of course, a close assessment of maternal well-being. So we take mom's vitals, we talk about postpartum bleeding, we check where your uterus is, we offer to do a pelvic assessment depending on how things went during your labor, and to assess the recovery of your perineum after giving birth. And then of course we check in about how's breastfeeding going for you, how has your nutritional, have your nutritional needs been met or not, and really checking in about what you need, what's missing, what supports are you getting, what supports do you still need, how can we help you to feel, vibrant and well in this really tender time with your baby. And then in addition to that, we're of course checking baby out head to toe every time we come see you. We're taking newborn vitals, we're checking their weight, we're observing a latch so that we can do a thorough assessment of breastfeeding and see how that's going for both mom and baby. We're talking about output, we're talking about newborn behavior, it goes on and on. And then we're offering all of the same newborn procedures at home that is offered to people in the more mainstream medical model, such as newborn screening. So we're offering the PKU tests at home. We can do heel pokes and submit those tests to the lab like you would receive from any other provider. And then of course after birth we're doing other newborn procedures if our clients choose them, such as vitamin K and erythromycin. So we're doing follow-up on all of those things, checking in on how baby is doing overall.
Yeah, and we also make referrals in the postpartum as needed. Of course, we're midwives and we're well trained in certain things, and part of our job is knowing when something has moved outside of our scope or when more support might be needed. So part of what we can do is kind of head off complications developing into something more serious by coming and seeing you and then making a plan, a care plan that might include other practitioners if that's appropriate. So we make referrals to lactation consultants as appropriate. We might recommend pelvic floor therapy if someone is needing some physical therapy after pushing their baby out. Of course, if there are mood disorders that are developing, which can be pretty prevalent in the postpartum period, then we're reaching out for resources. And part of our job in the postpartum is to connect people to the resources that they need so that they don't have to do that legwork, because it's a really big deal to have a new baby and you've got your work cut out for you, and it's nice to have a provider in your corner who is helping you to get what you need.
Yeah, and additionally, we're on call for all of our clients throughout their postpartum time period. So from the time a baby is born up through 6 weeks postpartum, our clients can still reach us day or night via the pager. So if they ever need anything from us, we're there for them to check in. And what's great about that is that we've had relationships. So of course we've been to our clients' births, so we know their birth story, we know how their baby has been doing from the moment they were born. And so the care we're able to provide over the phone is deeply rooted in, you know, your story and who you are as an individual and how we know you.
So that's a little bit about our postpartum care. There's a lot more to it, of course, but that gives you a brief glimpse into what it's like to be with us.
Yeah, thanks for listening.
Bye.